a youth mental health crisis is potentially the best thing that's ever happened to society if you can actually...
We often categorize sort of younger generations as being more open to behavioral health services than maybe generations before. There still is this unknown. You almost can't even engage in a conversation with anyone under the age of maybe 24 where they're not referencing TikTok in their dialogue. Saw this on TikTok, or I bought this on TikTok, or, here's a clip from TikTok. This is their world. We're not going to change that. Are you feeling overwhelmed? Let's do some deep breathing. It works. It totally works.
Yeah.
It is clinically sound. Do box breathing. It will work. But in that moment, that is really annoying to hear. So how can we change that dialogue?
If you're talking to a teen, what is your advice on how they should live to maximize both amazing things that they have access to today and their well-being?
The most important thing is
Leslie, thank you for being here. Thank you for coming on the podcast. Very excited to talk to you. For those of you who don't know, you recently joined our team, and I'm very excited to have you. I shared a little bit of the story of how we first met on LinkedIn, but I'll share it again here. I was running through Midtown Manhattan, like in the middle of the day. It is insanely busy. I'm trying to catch a train to go meet my dad in I guess it's not upstate, it's North New Jersey, for a golf weekend. And I get connected to you that same day, and I was like, I need to hop on a call with Leslie. Like, I've been looking for a chief commercial officer for like 9 months, and I just could not. I hadn't really found the right fit. And we got connected, and I was like, I gotta hop on a call. So I'm running through Midtown. I'm on the call with you. You're giving me like a very thoughtful explanation of your background and all the amazing work that you've done. And I'm like sweating, stressed. I have no idea where this train is because I'm not a big train user. And I'm running around the Amtrak hall trying to lock in with you. I'm sure that I'm like the worst, literally the worst conversationalist on this phone at that time. And I run up to my train as soon as it pulls out. So I totally missed it. Ugh. I was like 2 hours late to meet with my dad. I got off the call with you being like, wow, I missed my train and I just blew the conversation with the person that I definitely need in this role. But turns out I didn't blow it because you're here. So I'm very excited to have you. And I'm very excited to just talk a little bit more about your experience. You've done so many cool things across your many years in healthcare. You've gone from your early days at Blue Cross. You've went through a huge growth at MDLIVE and Papa. You spent a lot of time at BME. Like, you've done so many interesting things in the space that like, I just feel like there's a wealth of knowledge that I want to soak from your brain. So I guess like, maybe I'd love to just start like, how did you get here? Like, what was your story of, ending up in healthcare, going through your journey? Like, how do you conceptualize your journey so far?
Yeah, awesome. Well, thank you as well for having me today on the podcast and for that frantic conversation. I can tell you from my side of things, it didn't seem unusual at all. You were very on point, so much so that I couldn't wait to have the next conversation. Bummed that you were a little late to see your dad. Hope it didn't impact your golf team.
Didn't at all. I played great.
Amazing. But yeah, it has been a really, it's been a very fortunate journey for me through healthcare. And interestingly enough, when I first thought I knew what I wanted to do when I got out of high school and went to college, it was more on the treatment end of things in healthcare. I knew that healthcare was my happy place, and I wanted to become a physical therapist. So undergrad, I went to school to be an athletic trainer, and for sure thought I was going to go on to become a PT and be able to treat and really positively impact lives from that perspective. And by my senior year in college, not only was I really very much done with sweaty locker rooms and athletes. But I also was frustrated with the fact that there were so many more things that the athletes I was working with could do to prevent some of their injuries or rehab them more efficiently and more effectively. And I wanted to sort of swing the pendulum the other way and get more into sort of the wellness and disease management forefront, which is where I ended up focusing my grad school work. And that's really what I started off doing within the health plan, Blue Cross Blue Shield of Rhode Island. And so with that said, though, after almost 25 years in healthcare now, prevention is still a really really tough conversation
Mm.
because it doesn't make enough noise for people to really be engaged. People, a really wise leader of mine had said early on in my career, people will run from pain faster than they will run towards pleasure or things that are going to help prevent them from being in any type of pain or discomfort. And so, with that said, my challenge has always been how can we meet people where they are? Whether you want to bucket that into prevention or whether you want to bucket that into their challenge in accessing care from a holistic perspective, whether it's physical or mental health. And so my journey not only took me out of the treatment side and into prevention, but then I also very quickly realized in the early part of my career that innovation was something that I was fully committed to as a person, but also within the healthcare system.
Love it. So you've worked now, you went from very physical health, you spent time at MDLIVE, which is very much talking about physical health. You moved into a little bit of the I would say physical, but also behavioral health at Papa, and then now then in teen mental health at BME. Like, where did the transition into behavioral health and the passion for that come from? And like, what now today? Like, why do you still want to work on teen behavioral health as the thing that you're spending your very valuable time working on?
Yeah, absolutely. So there is no physical health without mental health, right? And so when I was at MDLIVE, and I always have to caveat that I was selling telehealth and representing telehealth before the pandemic, right? It was a completely
Wow,
different
what a challenge.
concept. Now it is assumed and it's table stakes, and that's why I loved it, because it was innovative, it was different, it was cutting edge. While I was at MDLIVE, our real focus was, reduction in cost, keeping people out of the EDs and urgent cares for, the very basic things like a sinus infection and things like that. But it was really also really improving access to care. That wasn't necessarily the mantra at the time. Halfway through my time at MDLIVE, we acquired a behavioral health company. And I saw firsthand the challenges of sort of enveloping the behavioral health piece into the physical health piece. They were so siloed. They were completely separate in an environment that should have been very easy to bring together because it was technology based. And that's when I think I really got the hook into individuals, mental state, and loneliness was one area that I was really passionate about through the entire age continuum. Really the two most lonely generations are those over 65 right now and the Gen Z and upcoming Gen Alphas. And so while I started off, addressing loneliness and mental and behavioral health within Papa, focusing on the older generation, the message and the mission of Papa was actually to connect those two generations together. And so that's where I then, again, evolved into being at BME and really focusing on teen mental health. And then from a personal perspective, I have two kids in that age group. So I have a 14-year-old daughter and a 21-year-old son. And I've seen the drastic differences each year of that adolescence brings and the challenges that their friends around them have faced pre and post-COVID.
What was a experience that you had with one of your kids that made you go, wow, this youth teen mental health thing is like really a problem?
Yeah, there were two. One was while we often categorize sort of younger generations as being more open to behavioral health services than maybe generations before, and open to those conversation about feelings and things like that. There still is this unknown. When my son turned 13 and we went to his well child visit, he was handed, without really an explanation that was somewhat intentional, a tablet to complete the assessments that we all know and use every day, the PHQ, the GAD, and the WHO. And he got really concerned about it because he thought that it was being targeted to him. And he actually said to my husband, his dad, who brought him to the appointment, he's like, why are they asking me these questions? Do they think something's wrong with me? So I saw through his eyes this very sterile clinical approach that we were taking with children that don't have anything to relate to. As adults, sometimes when we see those surveys, we question, gosh, what is this all about? Why am I answering these? And then the other piece was, again, because they've had no real lived experience with these things, whether it be clinical assessments or otherwise. The first time my daughter was scheduled to see a therapist as she was coping with the real first loss in her life of a grandparent, she, who is very sort of socially go with the flow, was so nervous about, what do I talk to the therapist about? Like, she knew it was bothering her, but she didn't know how to approach the conversation. She was sort of running through that scenario ahead of the therapy visit. And we gave her the option of, do you want to go in person to a therapist or do you want to do it virtually? And she felt, because of all those unknowns, virtually felt more comfortable. So it was those two like real eye openers for me of, wow, we are approaching behavioral health with kiddos the same way we do with adults, but kids are not little adults. And how can we do things differently?
So tell me more about that. Like why we obviously have a mental health crisis because of things like COVID, digital media, technology, lots of confounding factors. But why have we not made a dent in this? Like, there's been a problem since COVID, and an awareness of this problem. Why have we not made a dent? Is it because we're still treating youth behavioral health like adult behavioral health, or are there other reasons in your eyes why we haven't been able to make a dent?
I think there's a couple of things. One is certainly because we aren't really bringing things to kids in a way, teenagers in particular, in a way that they're interested or willing to engage. I think we actually do a really nice job with little ones, like the 0 to 5, even the 0 to 8, because it's very play therapy, and they understand that. But then you've got sort of this period of time, which is probably the hardest period of anyone's life, where your brain is developing, your body's developing, you have all kinds of social cues that you need to read into, 13 to 19 and plus, and you don't want to try something that's outside of your comfort. So we're not meeting them where they're at, or in a way that they're comfortable with. I also think that, to me, the most profound thing that happened, again, just in my opinion, during COVID, is that youth in particular lost a sense of control. So they used to be able to have some controls in their life. They would get up and they would go to school. They would get up and they would go to their sporting event, their theater, their art event. They would make plans with other friends. There were things that they could control in their life. And when COVID happened, they had no control. They couldn't go and do any of those things. So not only was that socially isolating, but it took things away from them that contribute to their ability to be resilient. So I often, say the phrase, whether it's with my own kids or their friends or what have you, is let's focus on the things that are in your control, right? So if you start stressing about things or worrying about things that are outside of your control, then you're just worrying about everything. So how do we, become more laser focused? They didn't have that opportunity. And I've found in my work that the generation post-COVID is less resilient. And so I think that while we, have lots of, clinical therapies and things like that in place for all of the behavioral health challenges and needs that existed prior to COVID, I don't think we've cracked the code on how do we make resiliency normal again and baseline.
Yeah, I think it's so interesting to talk about resiliency in kids, because they're so plugged in to what everyone else is doing, and there's so few opportunities for them to actually practice these skills today, and so many opportunities for them to retreat from the skills. And what we've seen really for the entire time that we've been supporting kids is you have a lot of kids who are outwardly really struggling, and the things that are causing that struggle are not things that are psychiatrist worthy, right? Like, they are not the true mental illness that would require true clinical treatment. They're the classic stressors of adolescence that are so heightened because those skills aren't there. And so I think you then get this divergence of need, because you really do need services when a kid is lacking resiliency and something happens. I always give this example. There was a teen a while ago in our program that received a screenshot recording of a group chat that she was not participating in where two of her friends had been bullying her in that group chat. And like that caused her to go and have a suicide attempt. And it was like, that's not a mental illness issue. That is a resilience issue paired with the stressors of being a kid today. So I think you're totally right. And I feel very aligned with that. I guess like, what does that mean for what we should do about it? Like you've been thinking about this problem for 2+ years beyond because you've had teens. Like how outside of the work that you're now doing at Something's, like how do you conceptualize the problem and like what it is we should be doing to try to address this?
I think first and foremost, we as a healthcare ecosystem, and that includes health plans, providers, hospitals, distribution channels of schools, community programming, and so forth. I think we need to take a big, huge step back from checking the boxes. There's a lot of reports and measurements and analyses that go into play when we think about managing our healthcare ecosystem. However, when I think about teens, they're not really showing up in the healthcare ecosystem. So they haven't had a lot of medical claims. They don't really see doctors that often. They don't have any comorbidities yet. So there aren't really good predictive models out there for when to intervene. That's not until more, medical experience has happened. And so how can we think from a human perspective versus like a project perspective in our healthcare system? If it was an easy problem to solve, it would have already been solved. But I think we need to take a little bit step back from, worrying about clinical assessments being filled out by teens. Worry a little bit less about, exact, processes that they need to step through in the healthcare system, and make teen mental health a conversation, and give them access to something that's going to help them through all the acuity levels, right? So we have created a generation that expects immediate response. And that example you gave where that teen saw that video of that group chat, the reaction is immediate, right? Where the intervention also needs to be immediately accessible. And we haven't really gotten there. We're still thinking about things from a very linear path in healthcare because that's the way we evaluate data.
Yeah.
So while I don't have a solution necessarily, I think the goal for me is how can we look at experience, what the youth experience is in interacting with the healthcare system, first and foremost, beyond just things that you can check the box on.
Yeah, I think it's a good point. I mean, like when you look at if you're looking at a pure dollar spend percentage, which is never a good way to look at healthcare, but like if that's truly what you're doing, they're not that expensive because they're kids and they're healthy. But and I don't know the exact statistics on this, but a majority of the spend in youth and teens is on the behavioral health side. It's also interestingly where the outreach and touch points are, right? Like you don't have a 14-year-old is never going to reach out needing a visit with their pediatrician.
Right.
But they will reach out because they need to talk to someone. And it's a very interesting opportunity to get them engaged, because the real cost and the real unfortunate thing, especially when we talk about the safety net and the system of care, is when you have these kids who end up in the emergency room, or they end up, very much in the expensive forms of care that are not the right places for them in a lot of settings, because it's a resilience problem. It's not always necessarily a mental illness problem. So I find that really interesting. And I think, like, I don't know that I've heard you talk about this, but I'm assuming that there is this acknowledgement too that, like, when it comes to the people who pay for healthcare, this group has kind of been forgotten. Do you agree with that? Or do you feel like that is a dynamic as to why this issue is still so prevalent?
Yeah, I absolutely 100% do, because it does come down to cost. So I often say, and I've, again, served in a health plan and been selling into and representing products going into health plans my entire career. So the healthcare system is so critically forefront for me. But at the end of the day, a health plan has to do two things. They have to provide a network of doctors, contract with a network of doctors, and pay those doctors. And so whenever there are prioritization filters, it always has to come back to sort of those two things. And like you mentioned, teens aren't showing up there. And we also know that health plans have, significant attrition of their membership, particularly the youth. And so there is, and again, this isn't a specific health plan's, disadvantage, but youth often become someone else's problem.
Yeah.
Right. So they may be covered by one health plan for a year, maybe 2 years. But when we step back and we see that 75% of all mental illness originates before the age of 24, we are really missing a huge opportunity here to impact the future. So we don't need to keep chasing our tail. We need to just stop and see. And again, I don't want to label it prevention. I want to label it access.
Yeah. Yeah, I think it makes sense. I mean, and this is where I think that the actual innovation and new attempts at trying to solve this problem have happened across Medicaid, because like one, there is an acknowledgement that the purpose of Medicaid is for people with disability and kids and parent and mothers. Essentially, it's the origination of it. But also, I think there's this understanding that like when someone does not have the appropriate service in the community setting and they end up at the hospital, it's really Medicaid paying for that. Like, it's because it's either they're uninsured or it is a true Medicaid patient, or there's just subsidies going through the system for that tax that it's paying on the healthcare system. So I totally agree with you. At the same time, like the sort of in-year savings, 18 to 24 month churn of members on health plans is real. These many health plans are getting crushed right now, especially with behavioral health spend. So like, how do you reconcile or how do you think about, you having worked at a plan, thinking through delivering on the core competencies and responsibilities of having a network and paying for services, but also staying afloat? With those considerations, how would you advise and what is the argument that you would make to a health plan leader who's trying to build better services for their kids, but also trying to stay afloat?
Yeah. I think there's a few ways to approach it. One is that we have to realize that all of these insured members are going to be insured by someone at some point in time. So you health plan are going to inherit some of these lack of access resources and behavioral health challenges that end up being costly at a later time. You're going to inherit those from another health plan for a variety of different reasons, whether it's on the commercial side, employer coverage changes, it's on the Medicaid side, moving or bids changing and things like that within the state. So there has to really be a mentality of more holistic approach, right? So if the health plans are going to make a commitment to not having to inherit those train wreck expensive situations, then they all have to really be participating and finding highly scalable, low cost solutions to do that. And I think that's really where teens are the best place to be investing, because they are plugged into technology. And they're going to leverage that technology that we know is highly scalable. And so I think taking a chance on that is very low risk. I think it's an opportunity for them to be contributing short term to the kiddos that are with them, and then long term for those that they're going to inherit down the road.
Yeah, super interesting. How do you? So I want to compare this. I don't know if this is the right comparison, but I want to compare the youth population to the duals population, right? Like go to the extreme of risk, of cost, of all this stuff. Like, what is the argument that you would make as to why youth are still worth investing as compared to the trade-off of duals? Like what is the value that still investing in youth is if you're trying to decide between other very high importance, high risk categories?
Yeah. I mean, you do have to prioritize, and you have to spend your money where you can and really make the most impact. But you have to budget that from a perspective of, yes, we're going to budget a significant amount of dollars to those high risk, high cost populations. But if we're not paying attention to the populations that aren't showing up right now, they're going to show up. They're gonna transition into that. And not that this is sort of a sort of follow up to your question, but I also think about the other people that are affected by teens that are not getting the care they need for their mental health, right? So parents and caregivers and siblings, they're all experiencing the effects of anyone in their family, their household that is being challenged and not getting access and positive impact
even bigger
from the resources.
You go to the school setting, if you have a death by suicide in a school, it really can challenge the entire school dynamic for the entire year. Like you talk to any administrator, like if it happens, it's a big thing.
Yes.
And you know, it is weird to have these conversations about dollars and cost and trade-offs, which are super real. And like, I don't disacknowledge at all. However, like we are talking about a 13-year-old's life, you know, which, I've heard some, you know, like how do you put a price on a child's life who has not even developed into being an adult who can really make decisions for themselves? Like it's an interesting conversation. I mean, like your passion exudes for this a little bit like me, because we live this every day, but like why do you think, you've had teen kids, you've seen it, but like there's a million problems you could have been working on. There's a million problems that you could have solved. I know that you've personally shared with me that your experiences in caregiving were really meaningful to you as well. Like, why this problem? Like, what about it is so fascinating and interesting to you?
It's going to sound really corny, but kids are our future, right? Like they're going to be sitting in these seats someday. We need to arm them with what they're going to need to feel successful as humans, whether they feel success in being a parent, in being an athlete, in being a corporate attorney. We need to arm them with that. We went through a pandemic that none of like generations haven't experienced, and pair that with the emergence of social media and where kids are spending their time, they need help. And so I think, yes, I'm passionate about a lot of things in healthcare, but I do think that the ripple effect of not caring for our youth right now is going to be a real detriment to the future.
Yeah. Totally agree. I don't talk about this a lot on the podcast because usually I'm interviewing people, but you're a special case, and I can talk to you a little bit more openly. But like my experience with an eating disorder was one of the harder things I've ever been through, and I've had a few other very serious challenges in my life. And every time I get to the other side, I'm like so amazed and grateful that I had something really hard happen to me, but then also had the support and the tools to get through it. And like now, having gone through enough major life challenges to where I feel like I actually am myself, I feel like I have a really solid worldview. I feel like I have a really strong set of tools to live well. I'm like so grateful that I have been through hard things to overcome that. So my hot take when people ask me about stuff is like, I actually think that a youth mental health crisis is potentially the best thing that's ever happened to society if you can actually provide the people who are struggling with the resources, the support, and the mindset and ideas to actually overcome and be better. And if they do, we could end up with a generation of like awake people, like truly awake, well, kind, thoughtful people in a way that I don't think we ever have. I also, now I'm going on a rant, but that's okay. CBT, which was the first time that and there's probably lots of clinicians out there who are going to fact check this. So I'm a lay person. This is my understanding of it. You can comment if this is wrong. CBT, from my understanding, was the first real time that at a broad scale, the mental health community believed that an individual could change their mind without requiring the treatment of a clinician. My dad was 27 when CBT was invented. Like, talk about an idea that is so foundational to who I am as a person that I have lived with now for most of my life that he never had the opportunity to live with. Like that is what makes me so excited for like the future of like, we now have the tool set and ideas that the amazing community of researchers have created over the last 4 or 5 decades, that if we can just give that to kids who are struggling, like oh my God, they'll be so much better for it. So
Much better. So much better. And has to be given to them in a way that they're willing to interact. So social media, TikTok, has become the de facto behavioral health set of tools.
Yeah.
For youth. They're very vocal about that. You almost can't even engage in a conversation with anyone under the age of maybe 24 where they're not referencing TikTok in their dialogue. Saw this on TikTok, or I bought this on TikTok, or, here's a clip from TikTok. This is their world. We're not going to change that. We're not going to change the way they're interacting. We're not going to make smartphones go away. Yes, was at a really important period of time where we started to observe things, for sure. But we as adults are heavily reliant on our phones for all of those things. We're on social medias. It comes to a point where you have to give them the tools to regulate that and enhance their ability to be discerning. So I'll share a quick story. A year ago, I was asked to be a judge at my daughter's middle school science fair. I love science. I love what the kids come up with. I was like, I'm all in. I'm going. There were so many great projects, but the one that, of course, because professionally, stood out to me was one of the students put together a project where she had 20 photos, and she asked people of different ages to identify which were actual photos and which were AI generated photos. And it was incredibly skewed to the younger participants in her study, were much more accurate on their answers.
They got it. They saw it.
They got it. They understood because they see this all the time. This is the world around them. It's those little light bulbs that go off when I see things like that. I'm like, this generation, they're amazing. They have skills. They are discerning. They sometimes get written off as they're just scrolling through TikTok all day long. No, they're being very particular about what they actually look at in their environment. And so we have to be there. We have to be interesting and relatable and comfortable for them to look at, because they're not going to give anything the time of day if it doesn't feel good to them.
Yeah, I think that's true. And I think there's also this false patronization that happens to these kids. Yes, they're different. Yes, many of them are struggling, but probably because they're so plugged in, they're also way more creative, and they're probably way more in tune. I think they're probably, as a generation, way more considerate of others because they've grown up seeing all sorts of people always. So, I think I agree with you. I think it's easy to write them off as challenged in some ways, but and maybe that's another opportunity from all this too, is the younger kids and kids going forward are going to have this new set of skills that if we can just get them to also enjoy their life and interact with other people well, that could be a beautiful thing.
Yes.
And I'm the first person to say that I think being plugged in all the time is probably not good for you, but I also know personally with people who are in my cohort, the people who are plugged in also feel like they kind of have an advantage in a lot of ways of, they understand how to share their messages with the world. They understand how to express themselves better. They understand how to be interesting. These are all things that are actually really important. So, okay, let's go to Leslie Advice Corner.
Oh boy.
Leslie Advice Corner. I want you to, you have been in this world. You've been on the health plan side. You've been on the provider side. You have kids. I want to go through and give advice to each of the groups. So we're going to start with teens.
Okay.
What is your advice on, if you're talking to a teen, what is your advice on how they should live to maximize both the amazing things that they have access to today and their well-being?
Oh, I think there's sort of the serious side of things, and then there's the softer side of things. The serious side is keep working really hard. Do the small things really well. Show up on time, right? Be responsible for your actions. Those are all really core. I don't want there to be this sort of soft blanket that goes over maybe just because you're challenging doesn't mean that's an excuse for not showing up and giving it your all. I think the softer side of it is there are resources out there for whatever you need, whether it's your physical health, your mental health, you want to become a better athlete, you want to become better at science. There are resources for that. And you, generation, you have access to those resources, where it was really hard for generations before you to get access to some of those resources. And then I think the most important thing is give yourself time to feel all the feels, as the kids say. So the best advice I think either of my kids ever got was for my daughter's directors in theater. And they said, when the cast list comes out, give yourself 24 hours. And I think it's a great lesson for all teams. Give yourself 24 hours. Because if you cared enough about it, you're going to feel really bad when you didn't get the role you wanted. Or you're going to feel really great about a role you didn't expect to get. But feel all of those feelings. I think we teach kids to just kind of keep powering through and not take a moment to acknowledge those feelings. And then that sort of gets built up in them. And then they don't know how to navigate that. So I think show up, work hard, access your resources, and just give yourself 24 hours.
Love that. Yeah, I think about that a lot in this idea of like, you have to honor how you feel, but you also have to acknowledge that how you act is a choice.
Yes.
And like, I think a lot of kids, and I think a lot of the cultural narrative around emotions recently has been how you feel is king. You should honor that always. And if someone else makes you feel bad, that's their problem, not yours. And like, I think that's not as close to the truth as like, you can't control how you feel. That's an autonomic system that is running in the background. So when you get put on the cast list and you're not the lead, you're actually like the third backup, you're going to feel horrible about that. But the choice that you have, and I do think like, although a 15-year-old's brain has not developed enough to have strong choice all the time, that is when you practice the reps of practicing the choice of, do I go and do I scream at my friend who got the lead role, or do I actually am excited for them and find a way to make meaning out of this to try harder next time if I really care about it, or maybe realize that it's not even for me, right?
All of those things.
Yeah.
Absolutely.
So great advice. This is off to a smashing success already. Let's go to parents. A parent of two teenagers who are struggling with their behavioral health. What advice would you give to parents?
I think parents should really embrace something you touched on earlier, where challenges that your kids face, or not making the team or not getting the lead role, like that's exactly what you want to happen. You don't want your kid to get into their adolescent years and have not failed. So embrace those things that are failures, small or large, and just be present for your kiddos through those. It's never about, oh, you're right, that kid is way worse at singing than you, or not a good kicker on the football team. It's, okay, this was a decision that was made. You put in your effort. There's going to be hard times. Nothing's going to change in your life moving forward that's going to make things smooth and easy. What you're learning right now is going to help you for the next time you have a challenge in your life. And while this, and that's the brain part for kids, is their brain still developing, where they don't have that lived experience to say, oh, well, I made it through that. So then the next challenge that comes up, I'm going to feel is going to be like a shorter recovery period, if you will. So be kind of happy when they fail, because it's going to make things down the road a little bit easier. Great advice. And in a way, I think sometimes the jump to saying, oh, that kid wasn't as good as you or whatnot, is sort of a jump to try to back your kids, I think, in a healthy way. But it almost invalidates the truth of the experience for the kids, so that they don't internalize that as something to be to build resilience around the next time. I think it's a very, very astute observation. Okay. Let's go to the healthcare space now. Yeah. Let's go to a behavioral health leader at a health plan who is really trying to advocate for, or they really care about youth mental health, but they're not sure what to do, where to start. What advice do you have for them on how to start? I think they really need to partner with innovative solutions and work in that partnership on a business case. So yes, is it not loud enough? It's not that pain that you're running from a cost perspective. Definitely not. But being able to really listen to your trusted vendor partners and understand how you can bring data to the table that is meaningful to your upwards chain stakeholders, and while at the same time being able to do something that maybe wasn't on the agenda, and then how to really find ways to commit to that. I think that a lot of times when health plans are partnering with different companies for different opportunities and solutions, they think that they have to know all that needs to be solved. But I don't think anything really effective happens in a silo, which is really where our fragmented healthcare system sits right now. So if we can partner on ways to get to thinking about that human at the end of the user experience, I feel like there's more success.
Love it. Okay, last rapid fire advice corner. What about a state leader who wants to build a better system of care for the youth in their state?
I think the states have possibly the biggest opportunity here, right? Because so if we like backstep into the weeds, a provider, a pediatrician that is interacting with a kiddo, and maybe they answered completely low risk on all of their very sterile clinical assessments that they were given. But the provider hears in conversation when they're asking about, so what activities do you do? And how do you spend your time? And what are your eating and sleeping habits like? And they start to hear some things that could use some support. They have to think about well, what health plan does this kid have? Therefore, what program can I refer them to? And because they don't have the capability to do all of that with all of the other really important things that they need to do as a provider, they default to, here's a list of therapists that you should go see. And that is not, while that is very much the answer in many cases, it is not the answer in all cases. And so how can we become more holistic in that approach? So the states have the opportunity that if they can offer something that is going to impact all of the youth in their state, then that makes everyone's job that much easier. The providers don't have to think about what coverage does the kid have. They don't need to think about, are they in a rural area or are they in an urban area? It all checks the boxes. Are they close to a community health center? Or are they not close to a community health center? Anytime you can reduce that friction that providers need to deliver, I think you're really winning. And I think the states have that opportunity to do that.
Love it. I mean, I can just like I can tell you exude with excitement for this. Like, why are you so excited? Why are you so optimistic that like we can actually make a dent here? That our society can actually solve this problem?
I think we don't have a choice. We don't have a choice. These kids are really struggling. And because I've sat in the entire healthcare continuum from basically birth to end of life, we have a lot of really effective programs in place for other cohorts of the age continuum. And we don't have that here. We don't have a choice. We have to do this. We have to do this. I'm all in, fully committed to making that change.
What is in 10 years when we look back and let's say that we've been able to just massively reduce the youth mental health crisis? What does that world look like? Like what has happened that has allowed us to sit here and go pat ourselves on the back and say, wow, great job, team. We really crushed this.
Yeah, it's going to be relevant access to care, relevant solutions that people are actually engaging in. That's probably one of the biggest things that has been, really desensitizing health plans in general for, and employers in general for, contracting for solutions that help a variety of different things within their service population, is that utilization is low. We're not really engaging. I remember when I was creating, weight loss programs and smoking cessation programs and stress management programs in my early days of my career, and you can have the best in class programs in place, but if no one shows up, it really doesn't matter at all. So if we can find ways to engage individuals, teens in particular, and 10 years from now, they're using those tools and they have immediate access to it, then I think the ripple effect is going to be huge. We could be here for hours talking about how employees aren't really showing up present to work anymore. Well, those employees are teens right now, 10 years from now, right? So how are we getting them to a place where they can be excellent teammates at work, excellent teammates at home, excellent teammates in their community?
Yeah. It's so interesting. I don't know I mean, I'm sure you're familiar with this, but there's a program called EPSDT, which essentially was created by the US government to mandate that children received necessary health services. It was originally created to make sure that they were fit to be soldiers, but it's still around. And I think the ethos is still there, which is like, we as a society have to take care of our kids. If we don't take care of our kids, we have a demographic problem where we can't fund Social Security. We can't fund any of the things that we want as old people. Like, it just doesn't work. So I'm totally bought in. I mean, you've been thinking about this problem for years now. Like, do you have any insights that you've gleaned about what a teenager today wants in order to engage with healthcare, with behavioral healthcare? Like if you were going to give a master class to, a big conference on this, like what would be the bullet points of your master class on how do you actually get kids to engage?
I think you need to take the healthcare part out of it. They don't understand any of that. Most of us as adults don't know how to navigate the healthcare system. Yep. So they have no life experience booking an appointment or understanding even what health insurance is. They don't, maybe in like the older teen years they do. So you need to take the formality and sort of the clinical sterility out of it and make it needs to be just the conversation. Mental health is conversation. If you're struggling with something, if you're feeling bad about something, that needs to be communicated, and we need to find outlets for them to communicate and reciprocating tools that don't sound like a toolbox in a way that they are going to engage. Like the rolls of the eyes that I've seen from kids when you say, "Are you feeling overwhelmed? Let's do some deep breathing." It works. It totally works. Yeah. It is clinically sound. Do box breathing. It will work. But in that moment, that is really annoying to hear.
Yeah.
Right? So how can we change that dialogue and make this less sterile and less clinical?
Yeah. It's kind of funny. It's like when you think about, and I think because a lot of people who are listening to this are adults, it's like, just imagine when you're like most angry or frustrated at something, yeah. When you're like, your emotional brain is so turned on. If someone just asks you like, "Hey, can you just like calm down for like take a deep breath?" Like, it's so aggravating. It makes it worse. And like, I think we have to remember that kids live there, like they live in that part of their brain. So every time they're in the moment happening and you're trying to do something like that, like it's not going to work. We tried actually in the early days when we were working on some things, we tried to build like meditation videos and things and use those to send to kids. And some of them liked them, but again, some of them were like, "Don't say, I'm not going to watch this video. Like, right. I want to, this is not relevant to me right in this moment," which like that is, and I think that's the unique thing about conversations is like, they are always custom to the exact moment.
Right.
So I think that's super powerful. We could probably talk for hours, which I'm sure we'll do more of these. I'll ask my famous final question. If you could snap your fingers and change anything about youth behavioral health today, what would you change?
I would change the check the box. There needs to be more flexibility in how we interact on the behavioral health front. It's not physical health. It's not, you have strep throat, we did a throat culture, we got a positive test, we're going to prescribe you an antibiotic. That's not mental health. There's nuance. And so I think if we could change that dialogue and that approach, I think we could make a lot more impact.
Love it. Thank you, Leslie. So excited to be working with you.
Thanks for having me.
We got a lot to do. We got a lot of kids to help.
And we need a lot of help.
If you're out there, you know where to find us. So thanks.
Thank you.